So very good morning, good afternoon, good evening everyone. So we are discussing about antihyperlipidemic agents. In antihyperlipidemic agents we have already discussed the statin, we have already discussed the cholesterol absorption inhibitors, then we have also discussed about bile acid binding resins, then we have also discussed about the fibrates, right? So all these drugs we have already discussed in the antihyperlipidemic agents. So today we are going to discuss about miscellaneous agents like vitamin B3. So can we use vitamin B3 as an antihyperlipidemic agent? So vitamin B3 is also being used as an antihyperlipidemic agents. So vitamin B3 is also called niacin or nicotinic acids, right? So as a anti-hyperlipidemic agents under miscellaneous agents. So nicotinic acids mechanism, how it do the anti-hyperlipidemic activities. So in your adipose tissues, this is your adipose tissues, for example, adipose tissues, there is a enzymes lipoprotein lipase. So lipoprotein lipase is a enzymes which do the formations of your free fatty acids. So these free fatty acids in liver it converted into triglycerides, and then triglyceride to VLDL, then LDL, like this, right? So what the nicotinic acids or vitamin B3 or niacin do, it block this lipoprotein lipase. These drugs block this. This lipoprotein lipase is blocked by your drug vitamin B3, niacin or nicotinic acids. If it's blocked, so what will happen? Free fatty acid will not available, and free fatty acid is not available for the formation of triglycerides. So liver will use the cholesterol molecules for the synthesis, and ultimately your LDL is also going to decrease. So that is the mechanism of actions of vitamin B3 as a anti-hyperlipidemic agents. But problem with vitamin B3, if there is a deficiency, so that deficiency we call pellagra, and for this deficiencies your skin will be inflamed, your sore of throat, छाले आ जाएंगे, आपकी स्किन में इन्फ्लेमेशंस हो जाएंगी, तो दैट इज वी कॉल्ड प्लेग्रा, राइट? सो प्लेग्रा को ठीक करने के लिए यू कैन गिव विटामिन B3 around 500 mg to 1000 mg, right? So that is available. But as an anti-hyperlipidemic agents we have to use high doses. So high doses of vitamin B3, high doses means you have to use more than 1000 mg of vitamin B3 if you want to use it as a anti-hyperlipidemic agents. So because we are using it high doses, so of course it could result in various adverse drug reactions as well. So adverse drug reactions associated with vitamin B3 which we are using for the anti-hyperlipidemic agent is, one of the adverse drug reaction is cutaneous flushing, right? Cutaneous skin will be flushed, right? And that is happening due to, because vitamin B3 will do the more synthesis of prostaglandins, increased synthesis of prostaglandin. This cutaneous flushing is happening due to increased synthesis of prostaglandin. So one way to handle this problem is you can use the aspirin, right? So before using the vitamin B3 as a anti-hyperlipidemic agent, you use a drug aspirin. Aspirin is a prostaglandin synthesis inhibitor. So it will inhibit the synthesis of prostaglandin, and prostaglandin synthesis is decreased, so cutaneous flushing will not be absorbed, right? Because cutaneous flushing is happening due to over synthesis of prostaglandin. So you are using a aspirin before giving vitamin B3, so cutaneous flushing adverse drug reactions you can handle better. There is another problem is pruritus. To handle these problems you can use antihistaminic drugs. right? Antihistaminic drugs, anti-allergic drugs, right? So, and another problem with at high doses is it can accumulate the uric acids in the body, so it can result in hyperuricemia. So if the patient is already suffering from gout, so it can this vitamin B3 is not a useful drug in that case, because it also accumulates the uric acid. So already in the gout patients, uric acid is already deposit, so your drug is also depositing more, right? So these are the contraindications or adverse drug reactions of vitamin B3 as a anti-hyperlipidemic agents. Now next one is your natural products. Natural products also we are using as a anti-hyperlipidemic agents, and drug is Guggulipid. Guggulipid is obtained from Commiphora mucul, natural plants, natural products it is. And particularly later on scientists have found that in Guggulipids there is a guggulosterone is a molecule which is particularly showing the anti-hyperlipidemic effect, guggulosterone. And this molecule Guggulipid is developed by our institute, that is a CDRI, Central Drug Research Institute, Lucknow. This institute has developed this Guggulipids for the management of hyperlipidemia. Mechanism is not exactly clear, but there are a it's a natural product, so there is a multiple mechanism which helps to reduce the triglycerides or your LDLs levels, right? So that is your Guggulipid. So this is about your anti-hyperlipidemic agents. There is a one more drug in anti-hyperlipidemic agents, that is Avercimib. Avercimib is a drug which there is a HMG-CoA, then there is a HMG-CoA, then there is a mevalonic acid, then there is a squalene, then there is a lanosterol, then there is a cholesterol. So this cholesterol is further there is a cholesterol esterase enzyme is there, we do the degradation of cholesterol into further products. So this drug is going to block here, but this drug is not approved for the marketing. Clinical trial has been done, but it's still not approved for the marketing. So I am not going in that detail, but here also you can play with these enzymes as well, which is responsible for the degradations of cholesterol. So this is all about your anti-hyperlipidemic agents, and next we will discuss in the next video about the drugs which are used in the treatment of shock, right? So what are the different shock? Thank you.